The world is a global village.
And that's because information travels beyond boundaries.
And on This Morning on ITV,
we guarantee unbiased analysis on topical issues
that will educate you,
entertain you.
So join us.
Join us.
Join us.
Join us.
Join us.
Join us.
Every Sunday to Thursday, 7 a.m. to 10 a.m. on your ultimate news and current affairs program on television. This Morning on ITV, TMI. Join us. The world is a global village.
And that's because information travels beyond boundaries.
And on This Morning on ITV,
we guarantee unbiased analysis on topical issues
that will educate you,
entertain you.
So join us.
Join us.
Join us.
Join us.
Join us.
Join us.
Every Sunday to Thursday, 7 a.m. to 10 a.m. on your ultimate news and current affairs program on television. This Morning on ITV, TMI. Join us. The world is a global village.
And that's because information travels beyond.
Today is World Prematurity Day, and we did say we're going to talk about it, at least a little, for today. I have Dr. Azubuike Amabunos here in the studio. He's a pediatrician. You're welcome to the program today.
Good morning. Good morning, viewers.
So, usually like starting from what is prematurity in babies?
Yes, prematurity, that's when babies are born too early. Usually pregnancy is carried for 40 weeks, and in a layman term, that's about 9.5 months, up to 10 months. So when babies don't stay up to the time, up to the duration that they need to stay, then they are termed premature babies. Medically, they are called preterm babies. But because when they are born, the baby's body is not sophisticated enough to cope with the environment, because the baby's system hasn't matured enough to cope with the environment. So they're generally referred to as premature babies. Generally speaking, babies should stay in the womb up to 37 weeks. Yeah. From 37 weeks to 42 weeks. Now, when babies do not stay up to 37 completed weeks, they are referred to as premature babies. But when they stay beyond 42 weeks, they are referred to as post-mature babies or post-term babies.
Okay, looking around us, would you say is on the rise, or it's not there?
Yeah, first of all, it's a huge burden. And I like to say here that parents who have had premature babies, the families that have had premature babies, the babies themselves that have survived, we want to appreciate them. We want to appreciate the mothers who have stayed patiently waiting for the baby to mature, maybe in the hospital or at home. So we want to salute the courage of these parents. It's not easy, because when people get pregnant, nobody expects to have a premature baby. Everybody expects to carry their babies to term. And when these babies are born before they are mature, before their term, it comes as a shock, you know, to the mothers and to the family, because they weren't expecting it. So when these babies are born, the parents are really embarrassed, and they go through a lot of difficulty first in trying to accept the situation, and then coping with the situation, and knowing that the baby is different from other babies.
Do they survive?
Yes, they do survive. They do survive, but that depends on how soon or how early the babies were born. I must say at this point, going back to the previous question, that premature birth is a huge burden in Nigeria in particular. Yeah, statistics have shown that about 15 million babies worldwide are born premature, and majority of these babies are born in India. India accounts for about 3.1 million premature births annually, followed by China. China accounts for about 1.1 million premature births annually, and surprisingly, third on the list is Nigeria. Nigeria accounts for about 778,000 premature births annually. So Nigeria ranked third on the list in terms of the number of premature births, and then followed by a country like America. In the whole of America, the population of America is twice the population of Nigeria, and yet they have a lower amount or a lower number of preterm births annually. Then fifth on the list is Brazil, having about 300 something preterm births annually. So if you look at it, you know, amongst the 200 something nation of the world, Nigeria ranking third on the list in the number of preterm births. It's a huge burden. And without these statistics, a lot of people do not know that preterm births occur in Nigeria every day.
Yeah, doctor, you know that that statistics, I suppose that's the one they get from the hospital, and you agree with me that there are a lot of babies that are born out of the hospitals that are not documented. So it's even possible that it could be more than that. But what causes this preterm birth?
Yes, there are a lot of causes of preterm birth, and I'm sure that most parents who has had preterm babies will tell you that they were not expecting it. So it happened unexpectedly in majority of mothers. The causes of preterm birth can broadly be categorized into two categories. There are those that babies are born in, the birth is induced. In other words, they're born either by cesarean section or by induction of labor. So it is the doctors that actually, or the health workers that actually bring out the baby before the baby is mature. And usually they do induction of birth or cesarean birth when there are problems, especially problems with the mother. For instance, if the mother has
life-threatening problem.
Yes, life-threatening problem. So if a problem, if the continual stay of the baby in the womb is a risk to the life of the mom, the doctor might decide to bring out the baby. Or if continuous stay in the womb is much more dangerous to the baby than being outside, the doctor will decide to bring the baby out. But majority of the cases are those that come spontaneously. The babies are just born spontaneously. Now, most mothers will tell you that maybe they were just about to go to work and suddenly they started bleeding. And then by the time they get into the hospital, the baby is almost out, and then the baby comes out. So the birth is unexpected. But just to generally say that one of the reasons why preterm birth is very high in our own society is because malnutrition, female malnutrition, malnutrition of young women, young girls, unexpected pregnancy. When women get pregnant when it's not planned and it's not expected, those are causes of premature birth.
All right, thank you so much, Dr. Azubuike, for coming this morning.
Thank you for having me.
Okay, this is just the tip of the iceberg. You join us on Monday on Healthy Living for
And on this